The legislation does face an uncertain future in the Senate, where Republicans' 2-vote margin makes any controversial provision in the legislation a potential bill killer. The president just tweeted about this morning, writing, quote, "Republican senators will not let the American people down. Obamacare premiums and deductibles are way up. It was a lie, and it is dead," unquote. Let's talk more about this with Dr. Tom Price. He's the Secretary of the Department of Health and Human Services. Thanks for joining us, Doctor. Appreciate it.
Oh, thanks, Jake. Good to be with you this morning.
So during the campaign, President Trump presented himself as a different kind of Republican. He said he would protect Medicaid. That's the health care program for the poor and also for people with disabilities. He said he would do that without making any cuts to Medicaid. Take a listen.
I'm not going to cut Social Security like every other Republican, and I'm not going to cut Medicare or Medicaid. Save Medicare, Medicaid, and Social Security without cuts. Have to do it.
Save Medicaid without cuts. But according to the Congressional Budget Office, the health care bill that just passed the House would cut $880 billion over 10 years from Medicaid. Now, I know that the Trump administration is excited that Medicaid will go back to the states where they have more control and can experiment and be more efficient. But without question, $880 billion fewer dollars is a cut. How is this not a broken promise?
Well, look at the Medicaid program that we have right now, Jake, and that's a program where 1/3 of the physicians that ought to be seeing Medicaid patients aren't. And that's because there's a fundamental flaw within the program itself. So what we're trying to do is to, and we ask you and the American people, to imagine a Medicaid system that actually works better for patients. Medicaid is a system that deals with the disabled, the elderly, healthy moms, and kids. And yet the federal government up to this point has said to the states, you've got to treat every single one of those individuals exactly the same. That doesn't make any sense to anybody. So what we're fashioning is a system that would allow the states to tailor their Medicaid program to those specific individuals, thereby saving money, yes, but also making it so that they have a higher level of care, higher quality of care than they currently do. That sounds like it makes a lot of sense.
Well, I know a little bit about this because my dad is a pediatrician in South Philadelphia, and he takes Medicaid dollars. And one of the reasons why so many of his colleagues do not is because the Medicaid reimbursement level for doctors is so little, as opposed to, for instance, the reimbursement level for Medicare, which is for seniors. Why will cutting $880 billion over 10 years from the program encourage doctors to keep taking it? It sounds to me that it will actually discourage doctors. Less money, lower reimbursement rates.
Well, remember what the $880 billion is off of. It's off what's called a baseline, which is what the federal government, what the Congressional Budget Office says we would spend if we just continued current law. The fact of the matter is that Medicaid spending under the proposal and under the budget goes up every single year, and it goes up by a factor that's that is equal to the cost of medical care. That means that the states will have greater flexibility to provide coverage and care for their Medicaid population than they do right now, and that's incredibly important because, as your dad sees, I'm absolutely certain that oftentimes the Medicaid reimbursement doesn't cover the cost of the provision of the care for those kids that he's taking care of. Now, imagine a system that allowed greater flexibility so that more resources could be put to the seniors and the disabled, and appropriate resources could be put to the healthy moms and kids in a Medicaid system. That's a system that, again, works better for patients than it does for government or insurance companies.
But the CBO, the Congressional Budget Office, looked at the plan that passed the House, although there were some changes to it, and said 14 million people who are on Medicaid will no longer be able to be on Medicaid. Governors from around the country, including these 7 Republicans I'm about to put on the screen, they're on the record saying they're concerned about these cuts to Medicaid in this health care bill. If you believe in sending this back to the states, shouldn't you and President Trump be listening to these Republican governors who are on the front lines?
Oh, in fact, we have listened, and we've listened very intently and had wonderful meetings with Republican governors. Remember that there are no cuts to the Medicaid program. There are increases in spending. But what we're doing is apportioning it in a way that allows the states greater flexibility to cover their Medicaid and care for their Medicaid population. This is incredibly important. And I know that you know, the media loves to talk about the cuts that the CBO talks about. But again, what the Congressional Budget Office measures is spending as if nothing changes at all, as if the program is doing just fine, thank you very much. The fact of the matter is that the program isn't doing just fine. And so what the President's commitment commitment is, what our commitment is at Health and Human Services, is to make certain that those individuals in the Medicaid population get not just the coverage that they need, but the care that they need. And that's what's important.
Are you actually saying that $880 billion in cuts, according to the CBO, however you want to talk about that not being a cut, that that's actually not going to result in millions of Americans not getting Medicaid?
Absolutely not. And we believe strongly that the Medicaid population that will be cared for in a better way under our program, because it'll be more responsive to them. These decisions will be made closer to them. Right now, you've got Washington, D.C. dictating to the states and dictating to patients exactly what must occur. That's not how a healthy health system works. A healthy health system works by allowing those individuals closest to the patients themselves to be making those decisions. And from the President's perspective and our perspective, that means patients and families and doctors making medical decisions, not Washington, D.C.
Well, as you know, a lot of doctors don't like this plan, including the American Medical Association, which you're a member of, which endorsed you to become Secretary of the Department of Health and Human Services. Tomorrow, a liberal health care group called Save My Care is going to launch a 6-figure ad campaign against 24 Republican members of the House who voted to repeal Obamacare in this bill. The ad notes that the bill is opposed by the AMA, the AARP, the American Cancer Society. What's your message out there to someone at home who looks at that list, who watches this ad and wonders, if it's such a good idea, why are those 3 groups against it?
Yeah, I would urge them to talk to their doctor, talk to their provider. When I talk to the docs that I used to practice with right here in Atlanta, what they tell me is that the current system isn't working for them or for their patients. We've got 20 million folks out there across this land who have told the federal government, phooey, nonsense. I'm not going to participate in your program because it doesn't do what I need done. So they're paying a penalty. They're paying the IRS a fine or a penalty because the federal government is dictating to them what they don't want to do. Or they're saying, give me a waiver. Now, that's a system, again, that may work for government. It may work for insurance companies, but it's not working for patients. So the system that we want is a system that works for patients and families and doctors. So talk to your doctor. Ask your doctor whether or not he or she is having challenges because of what the federal government puts in their way, the kinds of rules and regulations that make it more difficult for them to care for you. When I cared for patients, I knew that the federal government oftentimes was making it much more difficult for me to do for my patients what I knew to be best. And that's the system that we want to get away from. We want to get it in the direction of a system that works for patients.
As you know, a lot of working class voters went in there in November and pulled the lever for President Trump, having heard him say that he was going to keep their Medicaid, save their Medicaid without any cuts. CBO says this is an $880 billion cut. And I asked you at the top, and I'm wondering if you could just directly answer this, because one of the frustrations people had with how Obamacare was sold to the public is that politicians weren't straight. They didn't acknowledge that there were winners and losers. There were winners and losers with Obamacare. There are winners and losers with Trump care as well. $880 billion, that's a cut from Medicaid. How is that not a broken promise?
Well, look again, Jake, the winners under Obamacare were the federal government and insurance companies. The winners under the program that we provide and that we believe is the most appropriate will be patients and families and doctors. The reduction in spending that the Congressional Budget Office cites is, again, off the current law baseline. That means if we did nothing at all, if we just continued this broken program for the next 10 years, how much money would the federal government spend? I would suggest to you that the American people are sick and tired of business as usual in Washington, and they're sick and tired of their tax dollars going to programs that actually don't work. We want a Medicaid system that works for those patients. We want a Medicaid system that doesn't just provide them a card and says they have coverage, but doesn't provide them the kind of care that they need. That's the distinction that I would ask them to draw.
President Trump, in the Rose Garden ceremony for the House passing the bill, said that premiums are going to go down, deductibles are going to go down. You stand by that?
Absolutely, and it will so because you increase competition, you increase choices into the system, you allow young people who are now saying to the program, look, I don't need all that, you allow them to have the opportunity to purchase kind of coverage that they want for themselves and for their families, not that the government forces them to buy. That's a huge, huge benefit to, the individual patients. It may not help the government, it may not help insurance companies, but it's a huge benefit to patients. And if you're an individual patient out there that you've got pre-existing conditions, the President and the Department of Health and Human Services are absolutely committed to making certain that you are able to have coverage that you want and